How does perimenopause affect emotion regulation? Before we begin this presentation, meet Sarah, a 47-year-old CFO of a large paper supplier company. After recently entering the perimenopause period, Sarah has been finding it difficult to concentrate at work. She often feels sluggish, unable to concentrate, and plagued by brain fog. Last week, Sarah uncharacteristically yelled at and embarrassed the manager during a company meeting, causing the employee to leave the room crying. What brain mechanisms could be causing Sarah's behaviours? To explore Sarah's experience, this presentation will focus on defining perimenopause and exploring the brain regions involved in emotional dysregulation during perimenopause. Perimenopause is the period before menopause during which estrogen and progesterone levels fluctuate, resulting in various physical, mental, and emotional symptoms. Once the menstrual cycle has been absent for 12 consecutive months, women officially exit the perimenopause stage and reach menopause. There are three key brain mechanisms and regions that are involved in emotion regulation and that are influenced by fluctuating estrogen and progesterone levels during perimenopause. The GABA neurotransmitter system works to control nerve cell hyperactivity, which can cause anxiety, stress, and fear. But during perimenopause, there is a decrease in progesterone, the hormone that helps the GABA system to inhibit this hyperactivity. This means that anxiety and stress are increased during perimenopause, which can make controlling one's emotions more difficult. Perimenopause also involves fluctuating levels of estrogen that influence activity in the hippocampus. During low estrogen phases, decreased hippocampal activity results in impaired long-term memory formation and memory retrieval. This change in memory functioning influences how perimenopausal women respond to emotional situations. Finally, the amygdala exerts control over the evaluation of and response to stressful stimuli. During perimenopause, these mechanisms become dysregulated. Changing estrogen levels decreases the amygdala's control, resulting in long-term irritability, anxiety, and an inability to control one's emotional responses. Based on the information presented, what brain mechanisms are involved in Sarah's perimenopausal symptoms? Sarah is experiencing decreased GABA system and amygdala functioning, resulting in anxiety and stress, especially given her high role within the company. This also means that Sarah is quick to snap at her employees as she struggles to control her emotions during stressful work meetings. Sarah is also experiencing impaired hippocampal functioning, causing brain fog and difficulty recalling information during meetings. To conclude, perimenopause is a period characterized by profound physical, mental, and emotional changes. Estrogen and progesterone changes impact the neurological ability of perimenopausal women to regulate their emotions. The GABA system, hippocampus, and amygdala are the three key brain regions that influence emotional regulation during perimenopause.